colon cancer or colorectal cancer. This is a group of oncological diseases in which a malignant tumor is formed from the mucous membrane of the distal intestine. Pathology can develop due to hereditary predisposition, unbalanced diet, bad habits, chronic inflammatory bowel diseases. According to the frequency of diagnosis, colorectal cancer ranks first among malignant tumors of gastrointestinal cancer and third place in the overall structure of oncological diseases. Every year, malignant tumors of the large intestine are diagnosed in more than 600,000 people. At the same time, 60 to 70% of patients show late stages of the disease. Colon cancer is more often found in patients over 50 years of age. Most often, it occurs in males. Signs of colon cancer with bowel cancer, the symptoms in women and men are the same. But the difference in all depends on the localization of the tumor. Colon cancer can develop for a long time without any clinical manifestations. This is the main difficulty. As a rule, symptoms increase gradually, so a person does not notice significant changes. In most cases, symptoms occur even when the tumor increases significantly in size. However, there are signs that may indicate the development of this pathology. Therefore, it is important to detect them in a timely manner and not neglect treatment. Chronic fatigue. Symptoms of rectal cancer can manifest in the general condition of a person with increased fatigue, rapid exhaustion of the body, lack of appetite, and palpation of the tumor through the abdominal cavity. Chronic fatigue syndrome. This is a feeling that does not pass even after a full rest. As a rule, a person feels tired in the morning, immediately after waking up. With the development of this syndrome, there is a constant decline in strength and decreased performance, rapid fatigue, mood swings, sleep disorders, drowsiness, insomnia, shallow or intermittent sleep that does not bring cheerfulness. Other symptoms include problems with sleep, thinking, and memory, fog in the head, headaches, muscle and joint pain, hippopotamus-like symptoms, frequent sore throat, and others. Violation of the chair. Stool disorder is predominantly an early symptom of colon cancer. If the stool is disturbed, the digestive tract, intestines, or biliary system is disrupted. For this reason, the process of formation of fecal masses is disrupted. As a result, there is chronic constipation, diarrhea, or constipation, which is replaced by diarrhea. Stool disorder can be accompanied by constant bloating, flatulence, belching. Most often, people are concerned about constipation. This is a condition in which the passage of stool through the intestine is disrupted. It is manifested by symptoms such as the absence of a stool for more than 3 days in a row, painful sensations, discomfort, abdominal cramps, a decrease in the volume of feces, and at the same time, it becomes denser, a frequent feeling of overcrowding in the abdomen. In addition, severe diarrhea may appear. Diarrhea is a condition in which there is frequent stools 3 or more times within 24 hours, while the feces have a liquid consistency. And sometimes they are bothered by pains and unpleasant sensations in the stomach, sometimes not. If diarrhea persists for several days, then you should immediately consult a doctor. Severe diarrhea, even if it is not caused by cancer, but is dangerous because it leads to loss of fluid, electrolytes, impaired absorption of nutrients in the intestine. This is fraught with dehydration, exhaustion, and electrolyte imbalance, changing the appearance of bowel movements. Changes in the appearance of feces may indicate that there is cancer or another pathological process in the intestine. With constipation, it becomes more dense, with diarrhea, mushy liquid. If the cancer partially covers the lumen of the intestine, the stool becomes as thin as a pencil. It is also called a ribbon chair. With bowel cancer, the stool can turn black, resemble an external nail, and have an unpleasant smell. Such feces are called melena, and it looks like this because the blood is exposed to digestive juices in the stomach, intestines. Thus, melena can be a manifestation of cancer of the esophagus, stomach, less often small intestine cancer. In order for the stool to darken and acquire a tar-like appearance, at least 500 milliliters of blood must enter the intestine. The symptom is dangerous, so you should immediately consult a doctor. If there is a suspicion of bleeding in the digestive tract, which does not manifest itself in a change in the appearance of feces, the so-called hidden bleeding, you should take a stool test for hidden blood. But here it is necessary to evaluate the results of the analysis in combination with other diagnostic methods. Since this test can show a positive result for nosebleeds, bleeding gums, blood in the stool. If the source of bleeding is in the lower intestine, the patient may be concerned about the following symptoms: traces of blood on toilet paper, traces of blood on underwear sheets, streaks of blood in the feces, bleeding from the rectum. The appearance of blood fragments in bowel movements and intestinal oncology is observed during the advanced course of the pathological process. When the tumor violates the integrity of blood vessels and sprouts outside the intestine, if traces of blood are found more than twice on toilet paper, an admixture of blood in the stool, or the fact that bright scarlet blood comes out of the rectum, you should immediately consult a doctor. Mucus in the feces. Feces with mucus in an adult is not a typical manifestation for malignant intestinal tumors. Suspicion of cancer occurs when this symptom is combined with others, for example, bleeding, chronic diarrhea, or other symptoms. But in most cases, jelly-like mucus in the feces, or even mucus instead of feces, which are released in the intervals between bowel movements, are signs of infections in the intestine. Dyspeptic manifestations, dyspeptic disorders, are characteristic of colon cancer. This is a painful sensation, or a feeling of heaviness overflow in the upper abdomen. Such discomfort may not be associated with eating, accompanied by nausea, bloating, and heartburn, belching. Body temperature. In colon cancer, a subfebrile temperature is observed. This is a condition when the body temperature rises to 37 to 38 degrees and stays in this range. At the same time, it does not decrease with the use of antipyretics and antibiotics. The skin becomes pale, bluish, or jaundiced. It is quite difficult to determine this symptom, since with an increase in temperature in this case, a person does not have any other symptoms, and there is no reason to measure body temperature constantly in their absence. Involuntary loss of body weight. If there is a decrease in body weight, when a person does not adhere to a certain diet or does not try to lose weight in any other way, this may indicate colon cancer. This is due to the fact that during the development of cancer, appetite significantly worsens. With the progression of pathology, the body's ability to absorb useful nutrients is impaired. Anemia. Anemia is a pathological condition characterized by a low level of red blood cells or hemoglobin in the blood. Cancer cells gradually replace normal active bone marrow cells with cytokines, which is why there is a decrease in the production of red blood cells. As a result, anemia leads to a deterioration in the transport of oxygen to the tissues, which causes their oxygen starvation. Anemia is often associated with internal bleeding, intestinal obstruction. In severe cases, acute intestinal obstruction develops in cancer, a life-threatening condition. It manifests itself in the form of severe cramping, abdominal pain, constipation, nausea, vomiting. Due to a drop in the level of protein in the blood, edema develops due to fluid loss, dehydration. In addition, there is no stool discharge. The stomach increases in volume. Symptoms of intoxication and dehydration quickly increase. The process of putrefaction begins in the intestines. Toxic products enter the bloodstream and poison the body. Necrosis develops, necrosis of the intestinal wall. Its contents enter the abdominal cavity and lead to peritonitis. This situation requires immediate hospitalization in a hospital for treatment. Symptoms of other organs. In the later stages, when the tumor reaches a large size or grows into the underlying tissues, symptoms from other pelvic organs may occur. For example, urinary incontinence, mucus formation, and other symptoms. Also during this period, there may be general symptoms associated with intoxication and chronic blood loss due to hidden or obvious bleeding. Often people experience weakness, weight loss, fatigue, pallor, or yellowness of the skin. This is the end of the video. On the channel, you can find many interesting videos about the benefits and harms of vegetables and fruits, as well as about diseases and ways to treat them. Therefore, please do not forget to subscribe to the channel and click on the bell. I would also be grateful if you like and share the video with your family and friends. The Bioverse channel was with you. See you soon.